As most of you probably know, when you decide to go on Medicare, you basically it's boiled down to three options. You can have Medicare A and B only. Most people don't do that. And then you can have A and B with the supplemental plan. About 40% of all people do that, and today 50% are taking their third option, which is to enroll in Medicare A and B, but you replace that with the C plan called Advantage, which is a private health insurance company that is now replacing original Medicare for you, and now you're under a whole different system than the original Medicare system. And a lot of people are doing that today, but sometimes folks do not really understand what they're getting until they have health issues, and then there begin to be some problems. And so there's a lot of problems surfacing now. Certainly, as you research Medicare, you could find this information all over the internet today as people experience these issues and struggles with Advantage plans. And so we're going to talk about what the government is saying to Advantage companies now, as well as providers, hospitals, doctors. They're also having struggles with Advantage plans. So I just want to kind of summarize this. Here's really the five main issues that exist as problems with Medicare Advantage plans. The first one would be just simply denial of benefits. Denial of benefits. Some patients get in Advantage plans and they really do feel trapped, because what happens is they're promised by agents and by ads that they're going to have this low-cost quality plan, only to find out that oftentimes the treatments that they need are not going to be available to them. There was a recent report out by the Commonwealth Fund, and they reported that they found that 22% of all people in Medicare Advantage plans reported insurance approval delays. This meant a doctor said you need a certain service, and the Advantage plan did not agree with that, and they delayed it or even denied it. And that's becoming all too common today. Also, when people enroll in Advantage plans, they can't just go any doctor, any hospital they want to. That doctor or hospital has to contract with that private health insurance company. And so those that also can pose a problem because of limited networks. Every Advantage plan is going to have either an HMO or a PPO plan. So providers today have to decide whether they're going to participate or not. And so MA plans require patients to use their networks, their doctors and their hospitals, and that means there's going to be limited choices. When people choose a supplemental plan, they don't encounter that problem. They go anywhere that will take Medicare. But with Advantage plans, we're always going to have the issues with the networks. Also, an interesting stat out recently, a federal review recently done found that nearly half of all Medicare Advantage plan directories contain inaccurate information about available providers. So you certainly want to make sure your provider is in the network, but again, the resources out there today, half of them are inaccurate. And so that poses a problem. Another issue with Advantage plans, and frankly, this is my biggest problem I have with them. And I also want to let you know, we write them as a company. There are some people where an Advantage plan really is their best option, usually because they can't afford an additional premium to buy a supplemental plan. And so we write them. We just have to make sure that when we write an Advantage plan, people truly understand how they're going to work. And that really is the frustrating thing to us. And what we train our agents to do is to give full disclosure. We think you as the Medicare beneficiary have the right to know how your insurance is going to work. We're not just simply going to push a plan so that we can make a greater commission. And that's exactly what the majority of Medicare the insurance company. And this is why we see many doctors and hospitals today dropping Advantage plans, because they don't like the process.
Can you pause for just a minute? Our sound's messed up.
Oh, really?
Back up. Back on. It keeps messing up.
Okay. Sorry about that.
Okay. So just go over that last point.
Okay.
The whole thing.
Okay. What I was saying, I'm sorry for the technical issue there, but I was saying that the most, really the biggest difficulty that we have with Advantage plans is the process of prior authorizations. And that simply means that when you need maybe an MRI or a CAT scan, PET scan, you need a knee replacement or a hip replacement, you may need to stay in a skilled nursing facility for an extended stay. All of those types of services are going to require insurance company approval. And so what happens is your doctor on an Advantage plan can just simply recommend what they think needs to happen, but the insurance company has the final say-so. So the question is, who's practicing medicine? Is the doctor allowed to do it, or is the insurance company doing that? And so what people find out is on their Advantage plan, if the Advantage plan doesn't believe that you need a full hip replacement and a rod is sufficient, then that's all you're going to get. Or they don't believe you need a knee replacement now, you just need to go to therapy for 9 months. Well, that's all you're going to get. And so it can be very frustrating when people encounter health problems because of this prior authorization process. And this is the reason that a lot of doctors and hospitals today are dropping those plans. And again, I won't go into all my articles, but I've got a file here full of information and the problems with this issue with Advantage plans. This one is saying this: hospitals are dropping Medicare Advantage plans left and right. Though half the nation's seniors have these, a growing number of hospitals and health systems are pushing back and dropping some or all contracts with the private plans altogether, which means what? These Advantage plans are on hot water with providers. Why is that? Here's the most commonly cited reason: excessive prior authorization denial rates. Hey, we believe they need this, the doctor says you need it, and then they're not approved. Slow payments from the insurance companies as well. And they're getting billions of dollars from the federal government, but again, they're not paying these hospitals and doctors really the right amount of money, nor do they pay them very quickly. A gentleman who actually he's the CEO of a group in San Diego, said this: Medicare Advantage plans have become a game of delay, deny, and not paid. And again, that's why they're in hot water. I found this to be very interesting. This just happened a week ago. We had in our area here. Now, we're a nationwide broker. We can help you in all 50 states and District of Columbia. Happy to do that. But in our own area here in Kansas City, where our home office is, we had an Advantage plan that could not negotiate with a very large hospital group in this area. And that hospital group, they have 8 hospitals in this area. They have 7 surgery centers, and they have a pain management clinic. All 16 of those providers are no longer going to be in this Advantage Plans network. Why is that? Well, because that provider said, we're not getting paid enough, we're not getting paid quickly enough, and they're no longer a network. And so what happens? Well, someone want to go to that group, they can't go there. If they started their care, they have the right to go back as long as the doctor fills out a form. But anyone that's never been in care in that system, that plan is now out of their network. They're not an HMO or PPO. And this is what is happening throughout the country right now because these companies are not paying the providers. Just one more thing about this I think is very interesting. And this is an article, you can find this on your own through the Wall Street Journal. They've been doing some investigations into Medicare Advantage plan. And here's the title: insurer, brought in $50 billion through questionable Medicare Advantage coding. $50 billion in payments, and that was only a matter of 3 years of time. And this is because Advantage plans will oftentimes over-exaggerate the diagnostic codes because the sicker the patient is, the more money they're going to get from Medicare. And they really, truly are abusing the system, which really is getting money into the insurance company's pockets, but taking it from the Medicare program. So actually harming the Medicare program. And so on and on I could go, but I just want to let you know that right now there are some within Congress that really are kind of fed up with the way these insurance companies have behaved, some of the abuse that's going on, the denials of care, the delay of care. The big promise was that Medicare Advantage would provide care at a better price and better quality, and neither one of those has actually been delivered. And so that's why these companies are in hot water. And again, I want you to know we don't think Advantage plans are going to go away, but they're certainly beginning to change. The government is trying to hold them more accountable. And so it seems like when you give a private company, a for-profit company, the ability to have so much power, that power is abused. And so frankly, we're glad they're in hot water. We're not sure what's going to come of it, but time will tell for sure. And as Josh said, this is going to be a very interesting open enrollment season. And if you need help with any of your plans, switching, confirming that you're on the best one, we'd be delighted to provide that service for you. All right, so that's my 2 cents on that. If you have further questions, happy to address that. So I'd like to open up now to any questions that you have about Medicare, Social Security, and hopefully we can be of help this evening.
Okay, first off, Cindy Rose said, hi, an Advantage member here trying to make sense from a letter I received last week. That's all you said. Cindy, would you please go back and tell us a little bit more so we can tell us a little bit about this letter so we can help you understand it. Let's go to a question though. Ronald Johnson says, question, if I move to a new state and take my supplement plan with me, will there be a problem using the supplement if the supplement provider is not available within that zip code during IEP or SCP?
Okay, so if you do have a true supplemental plan, Ronald, it is a lifetime policy. It is totally portable. You can take it anywhere in the country. It is your policy as long as you pay the premium. So you don't have to worry about that. So that with providers, as long as that provider takes original Medicare, they will take your supplemental plan. In fact, we tell our clients, you don't even have to ask, will you take my supplemental plan? Just ask them if they take original Medicare A and B, because if they do, they have to take your supplemental plan. And that's the beauty of supplemental plans. 100% of all hospitals take them, and 99% of all doctors take original Medicare. So you almost have unlimited choices. So very, very broad network, so you should have no issue whatsoever.
But if they move with a supplement plan, what could happen?
Mm-hmm. The only thing that could happen is you could be re-rated. If you're moving to an area where rates are typically a little higher, the insurance company does have the right to increase your rate, but they also can sometimes decrease them. I've seen that happen as well. So whatever is normal and customary in that market you're moving to, then they could adjust the premium. But they're not adjusting it because you moved. It's just that's part of every insurance company's policy. They have the right to change it up or down.
Okay, Jill Westerhoff says, I have the N supplement, but I'm wondering if I should change to a G.
You know, Jill, I think an N supplemental plan is wonderful. I do. The only difference is, of course, and you know this, you've taken on the liability of excess charges if and when they occur. And again, less than a 5% chance, Jill, that you'll ever see an excess charge. It could happen. I had a lady recently that knew for sure she was going to go to a place that charged excess. So of course we put her on a G plan because she's going to experience that. So the likelihood of that ever happening to you is very low. Now, if you don't go to the doctor often, as you know, you're probably not going to spend too much on copays. N plans do have a $20 copay every time you see a doctor, $50 if you go to the emergency room. So if you are going to the doctor on a regular basis, that may be another reason. So I wouldn't discourage you from moving from an N to a G. However, if we know excess is a possibility and you are seeing the doctor regularly, then that may be a good move. You are going to probably have to qualify. There's 5 states where you would not have to qualify. That would be New York, Connecticut, Vermont, Maine, Massachusetts. But in all the other states, in order to make the move from the the N to the G, you are going to have to go through medical underwriting. So, Jill, you did not make a bad decision. I will tell you, I'm not quite Medicare yet. I'm getting close, a year and a half. I would go with the G because in my market, the only difference between G and N premium is about $35, $40. And so, so I'd say $500 a year on a G plan. But again, for me, in my budget, that's not going to make me or break me. So I would just soon have the most comprehensive coverage I can get. And that's why I would go with the G. Though if someone goes with an N, I still think it's a great decision. Right now, of all the people buying supplemental plans, 70% buy Gs, 30% buy Ns.
Okay, Melody Hoyt says, hi Marvin, I'm about to retire. I'm already 65 and I have Medicare A only. I know I need to get B, but beyond that, I'm not sure what I need. I'm waiting to get Social Security for full retirement age. Okay,
very good. Well, Melody, you can certainly continue to put your Social Security off, but if you're going to retire and lose the group plan at work, then what you're going to do, and by the way, I'm going to tell you the process, but this is something that we do every day, multiple times. Every one of our agents knows how to get you into Medicare under this enrollment period, Melody, that's called the special enrollment period. And this is for anyone who has A only or nothing at 65. Why? Because they kept working. So when we come into Medicare after 65, the special enrollment process is we have to verify that you've had employment and active employment and insurance at work. That could be your employer or your spouse's employer. And we have to verify you've had that coverage back to age 65. And as long as we can prove that, and we prove that with a form called an L564. And again, Melody, we would actually fill that out for you if you work with us. but that form is filled out by your HR department, and that form, along with one more form called a 40B, CMS 40B, and that's the form that says, I want to start my Medicare November 1, or I want to start my Medicare February 1, whenever you want to start. But that 40B form lets Medicare know when you want to begin Medicare. The L564 says you're eligible to come into Medicare using special enrollment, no penalties and no problems whatsoever. So that's what you need to do. Then you can make your decision as to a supplemental plan or an Advantage plan, what kind of drug coverage you want as well. And please call us. We'd walk you through the process, and certainly no cost at all for the services that we provide. Insurance companies pay us.
Yeah, and I think this is a good opportunity to let you all know that we love educating people, but we also have a team of people right outside these doors here that come to work every single day to help people like you walk through the Medicare enrollment process, from getting enrolled in A and B to choosing a supplement plan to choosing an Advantage plan, making sure you're on the right drug coverage, helping you with late enrollment penalty letters, helping you with income surcharges, special enrollment period paperwork, everything A to Z. And these services don't cost you anything, and we don't mark up the insurance either. We are paid by insurance companies as any insurance broker would be. We get all of our agents, there's about 50 of them licensed in all 50 states. So we are able to help anyone around the country, and it would be our honor to do so. There is a phone number scrolling along the bottom of the screen down here, 833-833-3661. You can call in. We've got people that are answering the phones right now that can schedule appointments for you for the coming days or weeks, and we would love to assist you.
Right. Yeah, 7 to 7 Central Time, Monday to Thursday, 7 to 6 on Friday. Call in and you can talk to one of our agents. And by the way, I've trained them all. They're well trained. They have our passion for making sure that you have the right coverage. We don't chase commissions. We're paid commissions by the companies, but our goal is to get the right coverage for every client that we have.
Okay, Cindy Rose says, I have an Advantage plan. I just received a letter that I know. Okay, you were answering the question from earlier.
Yep.
Perfect. I just received a letter that I no longer qualify for the Humana plan. This is the only letter I've gotten, unable to reach anyone by the phone. She says she has deceased spousal benefits. Probably doesn't. It's probably irrelevant.
Okay, well, deceased spousal benefits. Wow, I have no idea. I honestly, Cindy, I've never seen that situation because deceased. So I guess what you're saying is, we'll go back to the deceased statement.
She just says she has deceased spousal benefits.
Okay, good. So that has to do then with your Social Security.
Yeah.
So that would have really nothing to do with your Advantage plan. And so
Could be a DSNP, maybe lost Medicaid or something.
okay, yeah, if you're on Medicaid, if you no longer qualify for Medicaid, that would be a reason. Humana certainly writes plans that are called dual eligibles, Medicare and Medicaid eligibility, and if you lose that Medicaid eligibility, that could be it for sure. But now it may be that Humana in the future is going to drop that plan.
Yeah.
In fact, here in our market, the Blue Cross Blue Shield, Kansas City, they're pulling out of the market totally. It's going to impact 33,000 people.
Why don't you do this, Cindy? Why don't you call the phone number on the bottom of the screen, schedule an appointment with one of our agents. You can email us the letter, and then we can help you walk through it. And if that plan is no longer available, we'll be able to find you a plan that is available. That covers all your meds, your doctors, and hospitals and pharmacies. Love to help. Okay, let's do. Jill Westershoff said, I had an appointment set up with Sanitas, where I had been going because I had Blue Cross. They said they only take the B for primary care, and I would have to pay anything else. I don't know what that question is.
Okay.
We can just keep going.
I'm going to take the... Okay.
Maybe clarify that, Jill. LWRS says, hi, Marvin. Can you explain if you are able to help clients with unexpected bills, maybe due to coding errors and with Part D prior authorizations?
Absolutely. We have about half of our company is in customer support team, half agents, half customer support. So when any of our clients have a problem, you just simply call in and let the reception team know why you're calling. You'll be directed to what we call a Tier 2 agent, and that Tier 2 agent will begin to work through those issues. Now, what happens a lot of times when we have some of these coding issues, we like to find out for Medicare why they denied a claim, what code are they looking for, notify the provider, and then let them know, hey, this is the code that needs to be used for this particular situation, and this is how you'll get paid. And so oftentimes we get involved in that conversation. Part D prior authorizations, that is pretty easily done. We will help with that. This means that a medication is not on formulary, but you need it, and so you actually can fill out the prior authorization, or your doctor can submit that to the health plan, and usually they will cover that drug for the plan year. It's called a formulary exception, and they will add that to your formulary. But yes, we help with all that.
Okay, as in the days of Noah said, how do we change out from an Advantage to a PPO? We like a doctor not in program.
Okay, very good. And yeah, I think what you're saying, well, I think they're saying an Advantage to a supplemental plan.
Could be.
Okay,
maybe
well,
talk about both of them.
Okay,
how you
very
switch
good. Because
HMO
when you
to
say
PPO.
Advantage, okay, good. If you are in an Advantage HMO and you want to move to an Advantage PPO plan, which definitely gives you a broader network, then the process is this, and I'm assuming you've been on your Advantage plan for a while. If you've been on less than 6 months, you do have some other options. But if you have been on your Advantage plan for now a while, you can move Advantage companies October 15th through December 7th, coming up here in a few months, and the new plan would go into effect January 1. The other opportunity people have to move from Advantage to Advantage, HMO to PPO, would be the first 3 months of every year. That's called the Medicare Advantage OEP. And so when we make that move, what happens is I switch in January, my new plan goes into effect February, switch in February, new one starts March, switch in March goes in April. So we have 3 months of the first of every year to do this, and we have 7 weeks at the end of the year to do it. Now, if you're asking me how do you get off an Advantage and move to a supplemental plan, the same time frame would apply, meaning you can move from Advantage to Sup. But here's what you have to know. If you have been on your Advantage plan for any length of time, year, 2, 3, 4, 5 years, whatever, and you want to move to a supplemental plan, now you're going to have to go through the process of medical underwriting. This is one of the things a lot of people don't realize with their Advantage. If you stay on that for a while and you want to get off of it, if your health has changed, you may not be able to move to a supplemental plan. You may have to stay on the Advantage plan because now, except in those 5 states, the insurance companies get to underwrite you, which means they don't have to approve your policy. They're going to ask you about 30, 35 health questions, check all your medications, get a statement from your doctor, and with that information, they get to make the decision. When you first go on Medicare, they have to take you. They have to cover you. But after you've been on a plan for a while, they do not have to do that. All right? So, but again, happy to help with that process, tell you whether you can qualify, move you from an HMO to PPO, or move you to a supplemental plan. We can do it.
Okay, Laura Price, and she is watching. Laura, you're watching from Facebook. Guys, if you're not in our Facebook group, I will drop a link somewhere, maybe in the comments or somewhere. Join our Facebook group. We've got, I think, 45,000 people in that Facebook group, and we monitor it for questions every day. You can actually get in that Facebook group, and you can ask questions and hear from people who are clients or people who are not, but just folks like you who are on Medicare or trying to figure it all out. So you can look up in Facebook, just look up Medicare School Facebook group. I think it'll come up and join that. Oh, we just put the link in there. So you can click on that and join the link. But anyway, back to Laura. She said, my question is this. If you retire before 65 and don't have health insurance, are you penalized by Medicare at 65 for not having health care?
Absolutely not. Laura, anyone that has 40 quarters, which means they paid into the Medicare tax system for at least 10 years, and if they don't have their own 40 quarters, they can get it either from a spouse possibly or an ex-spouse. So as long as we have 40 quarters, we are eligible then to enroll into Medicare. Of course, you have to be approaching 65. But they're not going to ask you if you have any prior health insurance at all. The only people that could be penalized were those that didn't take it 65. They take it a later date. What they have to do is we have to prove they've been working and have had health insurance. That proof is on them. But if we start at 65, nothing other than 40 quarters turning 65, that's all you need. No penalties whatsoever.
Okay. That isn't, I don't understand that question. Do you understand that question?
Oh, yeah.
Okay.
I think so.
Maybe the first part. So if retiring at 62, Social Security is $24,000, how much can a person make without?
Yeah, without the penalty. Okay, here's the way it works. So if you're going to take a 62 right now, it's called an earnings test. So if you are working, and Bill, this is not investment income, rental income, pensions, annuities, distributions from IRAs, 401ks, none of that. Only working wages, commissions, 1099 income, salary, W-2, all that. That's what's counted for the earnings test. And so right now, if you take Social Security, as long as you keep your annual wages below $22,320, there will be no impact on your Social Security check whatsoever. Okay? Now that number does go up the year you turn your full retirement age. They raise that number up. This year that number is $59,520. That's the year you turn full retirement age. But once you hit your exact full retirement age month and year, there will no longer be an earnings test, and then you can make as much money of any kind of income source. It will not matter. But prior to full retirement age, we are subject to the earnings test. We call that the low amount and then the high amount the year you turn.
Okay, Giselle says, good afternoon. My question for you today is, if at age 65 and I am on Medicare, but I'm not starting Social Security until I'm 66 in 4 months, how does the Medicare get paid?
Very good. Okay, you have a couple options, Giselle. Obviously, if someone's on Social Security, their Social Security check, their Medicare comes out of that. But if you're not, Medicare gives you a couple options. Number one, they can just simply send you a bill. It's a quarterly bill, and you can just write them a check if you want. A second option, which I like, is called Medicare Easy Pay. And that means you're going to give the government a banking account, checking, savings account, routing number. And then what they will do is they'll go into that account once a month on the 20th of the month, and they will draft your Part B premium out of that. Another option is you can set up what is called a mymedicare.gov account. It's not SSA.gov, it's mymedicare.gov account, and you can actually go online and you can pay your bill through that website as well. So you definitely have some payment options. And then once you take Social Security, those will be deleted and they'll take Part B premium out of your Social Security check.
Okay, let's see. I understand people not being able to afford the sup plan, so they opt for MA with zero premiums. However, what if they get sick just one time? Are they in deep trouble?
Well, it just depends how serious the illness is. I mean, worst case scenario, and I've seen this before, someone cannot afford sup, so they get a Medicare Advantage plan, zero premium. If they're on a PPO plan, their max out of pocket is going to be in the neighborhood of about $5,000 to $8,000. We had a lady not long ago on an Advantage plan. Her max out of pocket for the year was $6,700. So that's the most she would spend. That's the limit that every plan has to establish a max out of pocket, and that varies. HMOs maybe $3,000 or $4,000, PPOs somewhere $5,000 to $8,000. Hers was $6,700. She got diagnosed with cancer kind of later last year, and she went through chemotherapy, radiation, had a surgery, very expensive, and so she maxed out $6,700. It rolled over into the next year, and because the max out of pockets reset every January. The max out of pocket stayed the same on that plan, $6,700. She's still receiving treatment. Again, it's very expensive for cancer treatment, and she maxed out again within just a couple of months. So literally within less than a 6-month window from one year to the next, having her treatment, she spent $13,400. That's when someone gets in deep trouble. Now, if they have no health or very little health problems, and they cannot afford a supplemental plan, then again, a Advantage plan could be a good option. I find that most people that are on Advantage plans, their max out of pocket is not going to put them into bankruptcy. Now, another thing that people are doing today, if their money is really tight, they make it a zero premium Advantage plan, and what you can actually do is you can get kind of a supplemental plan to that. Those are called indemnity plans, critical illness plans, copay protection plans, all the same. And what they do is they will help you with cover the expenses of being in the hospital. They'll pay your daily hospital copays, and if you have a serious illness, they will give you a lump sum, maybe $5,000 or $10,000 to use to offset the cost of those serious illnesses. That's a good way to go. And those premiums are $35, maybe $40 a month. So if they can't come up with the max out of pocket, it'd be better to get some insurance and pay a little bit every month so that insurance company then can help you to offset that max out of pocket.
Okay. Jeffrey Gantner said, this was my first year with the Plan G. Do I need to shop around for another plan during open enrollment?
Okay. Not necessarily. Jeff, even if you get a rate increase, if it was reasonable, I know some carriers had some fairly high rate increases, but if that rate increase came and it was reasonable, just say 5 or 7% or something, that's not too bad in this market. you don't have to shop around. But by the way, if you're our client, call in. We are happy to tell you where rates are currently, and if we can find a better situation for you, a better option, happy to make that move. Now, most states, you're going to have to medically qualify to do that, but we'd be delighted to walk you through that process. So it's not a problem whatsoever.
This is a funny question from Cobra. Cobra says, at times you say Advantage plans are the way, then other times you say supplemental plans are the way. So what is it?
That's funny. Okay, let's be clear. Okay, I prefer supplemental plans. I prefer them. And the reason is because you don't have to deal with network issues, no pre-authorizations. You pay the premium, you've got a permanent plan. It's the same anywhere in the country, okay? Much easier to use, no insurance intervention, hassles, none of that, okay? I love supplemental plans. That's what I'm gonna do here in a year and a half, for sure. So why I talk about Advantage plans is to say they're right, because sometimes people cannot afford in their monthly budget a premium for a supplemental plan. They sometimes have a difficulty just paying the Part B premium. And if they're stretched just to pay the Part B premium, I know it's going to be probably impossible for them to afford the extra $125 or $30, $150 a month for that supplemental plan and that drug plan. And so I have found in 15 years in the business, if you cannot afford it now, you're not going to keep it. So in that situation, let's find the very best Medicare Advantage PPO plan that we can in your area. That's all I'm saying. I love supplemental plans, and I have hundreds of reasons why. Okay, but there are times when it just is not going to be possible for some people financially.
Okay, Steve says, are supplement premiums automatically deducted from Social Security benefits?
Never, never. The only thing that comes out of a Social Security check would be your Part B premium, and if there's a premium for your drug plan, you can opt to have it deducted there, or if there's a premium on your Advantage plan. Some Advantage plans have premium, it can come out of there, but supplemental plans cannot at all. You'll have to have those deducted out of a checking or savings account.
We got some good questions.
Good.
Okay, Medicare, Bob Thomas, this is a quick one. Bob Thomas says, Medicare Supplement Insurance is Plan G?
Yes, there's actually 10 different supplemental plans. They're all given a letter, A, B, C, D, F, G, K, L, M, and N. So the top 2 plans today are G and N. And so what they're going to do is they're going to fill in those gaps that Medicare did not cover. Medicare pays. And just know this, folks, Medicare doesn't pay for anything 100% other than preventive services. There's any service you get other than preventive means there's going to be a balance to the bill. We call that a gap, a financial liability of yours, and you can take, there's 6 gaps, and you can take those gaps, 5 of the 6, and you can transfer that gap liability to an insurance company. And when you get a G plan, it's going to cover 5 of the 6 gaps. You would only have 1 gap once a year, the Medicare Part B deductible. It's almost full coverage, folks. So Plan G covers 5 of the 6 gaps. You would have to pay the B deductible. This year it's $240 one time, and then every January it resets. So someone with a G plan has to satisfy out of their own pocket the B deductible once a year. And the second popular plan is an N plan. Still, they're both very good. You just have to decide what's important to you. N plans are a little less expensive, usually $35, $40, some states more. But you take on excess charge responsibility if and when that happens. That's a doctor that adds 15% to the bill. N does not pay that. G does. And then within, anytime you see a doctor, you would have a small copay up to $20. So you're taking on a lower premium and a little bit more liability. Both are great.
Okay, Michael Webb says, will Medicare A pay for hospitalization if the patient's stay is less than 3 days?
Absolutely, yes. The 3-day issue would be if you're in a hospital and you want to go and the doctor puts you in a skilled nursing facility. Yes, you have to be in a hospital 72 hours or longer before Medicare will cover you in the skilled nursing. But if you're in the hospital a day or 2, Medicare is happy to pay that. So the 3-day issue has to do with skilled nursing facilities.
Okay, I want to pause real quick. Everybody, if you can, if you're finding value out of this, if you like this, hit that like button. I think it's a thumbs up button on YouTube. Hit that thumbs up button on YouTube. We like to get these that button hit because it lets the YouTube gods know that you're enjoying this, and that pushes it out to other people to see. So please hit that like or that thumbs up button on YouTube. Secondly, if you are our client, we would love to know that you're on here. So just put in the chat, hey, I'm one of your clients, and I worked with Steven Swanson, or I worked with Aaron, or whoever. We just want to know so we can say hi to you all. So let us know if you're our client. Okay, back to normal programming. Craig Burlingame says this: is it difficult to have clients change from an MAPD to a sup plan?
Okay, It can be. If you're on an MAPD that you've been on for a while, and I mean a year, 2, 3, 4, 5 years, to get off of that MAPD plan, there's 2 times a year you do it, October 15th to December 7th, or January 1 to March 31. You return to original Medicare, you're disenrolled from your Advantage plan. To get the supplemental plan, though, you have to be medically qualified to do that. So you're asking, is it difficult? If someone is taking some kind of heart medication or they're in the midst of cancer treatment, they're not going to get to do that. If they're an insulin-dependent diabetic that has problems, too much insulin, not going to get to do that. AFib, not going to get to do that. Rheumatoid arthritis, spinal stenosis, all those kinds of health conditions will keep you from making that move. Now, if you just being treated for a little, high blood pressure, some cholesterol, those kind of things, those are not going to be declined. But if it's a serious health issue, unless you live in New York, Connecticut, Vermont, Maine, or Massachusetts, you're probably not going to make that switch. But again, call us, let us know, because all of our agents know what types of qualifications would keep you on, and we have some carriers that are a little bit more lenient than others. Okay, I'm not going to say they'll take anybody, but we know the underwriting guidelines by each of the carriers, so we can make a recommendation so that if you want to make that switch, that's possible.
Okay, you kind of just answered that. Question. Let's do this one. The question is Medicare and Medicaid with a standalone Part D still good?
Okay. Yeah, I think it's fine. The only issue with your situation with Medicare, Medicaid, you're required to go to, if your Medicaid is going to pay, you have to go to Medicaid providers. And that's not a real extensive of a list today. And so that really is the only issue. So I think that is fine coverage. I would look at, if it were me, I'd probably look at a dual plan. Yeah. There are some specially designed Advantage plans for dual eligibles, Medicare, Medicaid, and sometimes those are very attractive. They come with some nice little benefits. And so what you have is fine. I think you could probably improve your position. And you can do that any time, by the way. You can call in and those plans can be added any time, right? Special enrollment monthly. Yeah.
Okay, Ellen McKee says, what deductions are taken out of your Social Security check monthly?
Okay, if you're on Medicare, your Part B premium is going to come out. Your drug plan could, your Advantage plan could, if you have any of those, so that's going to come out. And then if you would like to have taxes taken out, you actually have to fill out a form. I think it's called the WV4 or something. You can Google it. But you can actually have them take out income taxes if you would like. You fill the form out. I think you can opt for 7%, 10%, 12%, or 22%. And otherwise, your check's just going to be gross. So the only thing that comes out will be Medicare Part B, drug plan, Advantage plan, if they have them, and taxes if you ask.
Cindy Rose, which we were talking to you about that Humana plan earlier. You said, can I speak with someone by the phone one-on-one? Absolutely. Call in, schedule a one-on-one appointment. There's probably somebody who's available that could talk to you right now.
Right.
If not, they'll get you an appointment set up for tomorrow or maybe first part of next week.
We can help you, Cindy, and we'd love to.
Jill Westerhoff said, thank you so much for the answer. We answered one of her questions earlier. I think I have 6 months to change without the underwriting.
Exactly right. Hey, everyone needs to know this, once your Medicare Part B date has started, you have entered into what is called the Medigap OEP, Medigap Open Enrollment Period. And this is in all 50 states. And we have the 6-month window from that B date where there's no underwriting. The insurance company cannot ask you any health questions. They have to cover all your pre-existing conditions. They have to approve that policy. It's an awesome, really privilege to be able to be in that period. Now, listen, for those of you that are just now approaching Medicare, you don't have to wait till that date starts to get a supplemental plan. Some states we can apply 3 months in advance, other states 6 months in advance. So when my B starts, my supplemental plan would start at the same time. It's a very smooth transition. But it is true, once the B date starts, we still have 6 more months where you're in that period of time that get anything you want. Any plan that's in your area, any carrier, they all have to write you.
If I move from Plan G to Plan N, but then I decide I want to go back to Plan G, can I do so without answering health questions?
No, sir. No. Now, there are states that they're called birthday rule states, anniversary rule states. There's about 16 of them that do have some more lenient rules for you switching plans around your birth date, certain times of the year. But those switches are usually like to like, G to G, or like to less, G to N. So if I'm on an N, you can move to another N plan, possibly without no underwriting if you're in a birthday rule state, but you're not going to be able to move from an N to a G anywhere without medical underwriting, except New York, Connecticut, Maine, Massachusetts, and Vermont.
Okay. Megan Salaterman says, I work for a company with more than 20 employees, but most of them are union contract workers, not W-2. Does the 20 employee requirement apply?
Okay, Megan, the way that works, it's 20 people that are on the payroll. Part-time, full-time doesn't matter. So I honestly don't know if that would include someone that's getting a 1099. But yeah, 20 or more on the payroll. So if these are union contract workers, I guess if they're continually employed by the company, I would say you should be fine.
Do they have insurance through the union? If it's a union, that's kind of interesting.
Yeah, well, yeah, they could have. But that's officially the way it's worded. 20 people or more on the payroll. And so I would say if they're on the payroll on an ongoing basis, is someone they just hire occasionally, I would not call that an employee.
Okay, 65 and 2 months, haven't worked for years. I have no income, Medicaid for healthcare only. Can I delay Social Security? What are my options for Medicare?
Okay. Well, Kathy, what I would do if income is very low, what you want to do is stay on, of course, your state Medicaid. And then what they will probably do, depending upon your income level, they're probably going to help you with your Medicare Part B premiums. Most state Medicaids will pay for your Part B premium. So that'll be a real blessing to you. And so you don't have to take Social Security because Part B will probably be covered by Medicaid. And then what I would do is I would enroll into what is called a dual eligible plan. These are special needs plans for people that are on Medicare and Medicaid. And we write those plans and be happy to assist in that process. That's the best for you financially.
Okay. What about dental and vision?
Okay, very good. Well, if you decide to take an Advantage plan, Advantage plans today will give you some kind of a dental allowance. And that means they'll cover about $1,500 or so of services. The negative on the Advantage plan is that some of them require you to see a certain network provider, and sometimes it's difficult to find a dentist that will even take the plan. But that's called a dental allowance with Advantage. Advantage will also give you one routine eye exam a year, and they will give some credit, about $200, $250 a year for eyewear. So that's on the Advantage side. Over on the original Medicare with the supplemental side, original Medicare and subs are going to cover everything that would be big when it comes to vision. Cataract surgery, glaucoma issues, macular degeneration covered. All the things that would be eye disease are covered by original Medicare and your supplemental plan. So what some people do that get supplemental plans, they will get a small standalone vision plan to kind of offset the expenses of their eyewear and get an eye exam once a year. Keep this in mind. Medicare will pay for medically necessary eye exams and all the diseases, everything needed. The only thing Medicare doesn't cover, nor supplemental plans, would be routine eye exams and eyewear. All right, so you've got great coverage with original Medicare. Now, when it comes to original Medicare and dental, you basically have nothing. The only way original Medicare covers dental is if it's real severe. You've had cancer of the jaw, and they had to do some reconstruction of the jaw, therefore the teeth are affected, Medicare covers that. Someone's getting ready to go in for a kidney transplant or a heart valve replacement. Medicare is very concerned about your oral health because that could have impact during the surgery, so they will participate in that. So people that stay in original Medicare with the supplemental plan typically buy a standalone dental plan. We write them, they're good. I have one. They'll usually cover about $3,000 to $5,000 worth of benefits every year. The preventive is covered 100%. Basic services, which are low-cost services, 80-20. Major services, which are your root canals, implants, crowns, those kind of things, covered at 50-50. And so those are great plans. If you have perfectly healthy teeth and never use it, you may just want to self-pay. Sometimes dentists offer plans. People look at that as an option as well. But again, call in and we can tell you what really is best in your particular market.
Okay, BJ Hall says, I have a Medicare PPO plan through my retirement plan. I went to the emergency room for a GI bleed, and ER doctor wanted to admit me, but my Advantage plan denied my admission. ER discharged me in an unstable condition.
Yeah, that's sad. and that is not uncommon. What I would do, if there's any way that you can, I would get off that plan. You clearly have a plan that is not taking care of you. So I don't know how long you've been on the plan. I don't know where you live for sure, but you may have some options. Even if you have some health problems, you may have some options to be able to disenroll from that employer-provided Advantage plan and get a supplemental plan. So call in and tell us some more about your situation, see if you do have some options. But I'd be done with that plan.
David Phillips, I received some 401k income. Will my Medicare Part B premium increase?
Yes, your 401 income will definitely affect the number that Medicare is going to look at to determine your Part B premium. For those of you that may not even be familiar with this, what we're talking about is what's called a modified adjusted gross income. So if I'm on Medicare in 2024, what's happening is Medicare is looking at my 2022 tax return at my modified adjusted gross income. Very simple. Line 11 plus line 2A. That's what it is. Line 11 plus 2A. And that number is reported back to Medicare, which with that number determines your Part B premium. So your 401k income is in your adjusted gross income. It's on line 11. And so if you're single and that line, that modified adjusted gross, if you're single, is above $103,000, regardless of the income source, or if you're a married couple, file a joint return, if you're above 206, then yes, you will pay more for your Part B premium. That's called an IRMA, income-related monthly adjustment amount. Right? So it will. All income does. Okay.
Okay. Carlos Diego in our Facebook group. So if you haven't joined yet, join. How do I get in touch with you? I'm 62 and I will retire at 65. So he's really early.
Yeah.
Just call the phone number. Write this phone number down at the bottom of the screen. Another thing you all can do is you can go to our website, which is medicareschool.com. Medicareschool.com. It's right here behind us. And you can either sign up to talk to us, to schedule an appointment with one of our agents, or right next to it, there's a button that says free workshop. In the free workshop, I think it's about 60 minutes long. It's probably the best way on the internet to learn about how Medicare works. So my dad goes through Medicare A, B, C, and D very sequentially. Talks about plans F, plans G, plans N, how to get drug coverage, and all the enrollment rules, the IEP, SEP, all of these different penalties that you need to know how to avoid. Everything that you need to know to be able to get on Medicare, you can learn in that workshop. We call it the Medicare Essentials Workshop. So go to our website. If you haven't watched it already, do that. It's probably a little better than just watching a million YouTube videos. So anyway, let's go to the next one. From Megan, what is the estimated percentage of people who enroll in an MA plan and decide to switch to A and B and supplemental plan because of disappointment with networks' prior approvals?
Yeah, well, the one stat I do know, Megan, is that they say right now that 52% of all people are enrolled in Medicare Advantage plans. And those deciding to switch back, I would not have any idea at all. I do know this, people do it on a regular basis, and I also know that some people would love to do it, Megan, but they can't because they can't medically qualify to make that switch, actually get a great insurance. And listen, I'm not trying to beat up on Advantage plans, but I will tell you this, even the government themselves. In fact, I had this, let me just read this real quick, Josh. I thought this is very interesting, if I can find it. This is a government report. I'll look for it in a minute. But it said this. Oh, listen to this. This is quality in MA. This is MedPAC. This is the current state of quality reporting in MA plans is such that the commission, this is a government commission, can no longer provide an accurate description of MA quality of care. Beneficiaries lack good information on the quality of care provided by MA plans in their local markets, limiting their ability to make informed choices among plans. I mean, I'm just saying to you, when the government talks about Medicare Advantage plans, it's not like they're going to get rid of them, but when they describe them, they say it is low medical coverage, okay? When they talk about supplemental plans, it is high medical coverage. So with supplemental plans, we have high medical coverage. Now, we don't have all the little perks that the Advantage plans throw in, but we've got great medical insurance. Advantage plans, low medical coverage, a lot of little free perks, okay? That's the difference. And you have to decide what's important to you.
Okay, Chris says, does everyone go through underwriting when going on Medicare and Supplement?
Not necessarily. In fact, the best time to get a supplemental plan is when you decide to enroll into A and B, whether that's at 65 or 67, whatever. But once you go on Medicare, that B date is the key date to your question. Because once I've started my B date, I do not have to go through underwriting. I can apply 6 months before my B date, and then 6 months after my B date, I'm in this window where the insurance companies cannot ask you any health questions. Federal guideline says everybody going on Medicare, once their B date has been established, has the right to get any supplemental plan in their market, their choice, based upon their age. Because remember, folks, there's two plans that you cannot get today if you're started Medicare after 1/1/2020. There's two of them, C and F, not options. So if you start Medicare after 1/1/2020, you can get the G plan, the N plan, some of the other plans, and you can get that without any underwriting 6 months of your B date. 6 months before, 6 months after. Insurance companies can ask you no health questions whatsoever. They will approve that policy.
So let's answer this one. And Luz says, what reasons may a supplement deny her?
Okay, it varies. As I said earlier, there's about 35 to 40 health questions on that application. And so they're going to, they have what we call lookbacks. They're going to ask you, in the last 36 months, have you been diagnosed with or treated for any form of cancer? If you have, they're going to deny you. Now, if you had cancer 5 years ago, 10 years ago, it's not going to be an issue. Right now, if let's just say you had a stent implant 2 months ago, they're going to deny you. If you have an AFib diagnosis in your health records anytime, they're going to deny you. If you have rheumatoid arthritis, they're going to deny you. If you have osteoporosis, especially if you've ever had a fracture, they're going to deny you. So there's certain health conditions that would keep you from actually passing through underwriting. Now they'll take some things, as I said earlier, they'll take high cholesterol, blood pressure, some issues that maybe were years ago is fine. Let's say that your doctor has told you that you need a knee replacement, but you haven't done that yet. You're not going to get approval. They're going to ask you, do you have any upcoming surgeries? And so if we can get through underwriting, then you'll be able to get the supplemental plan. And sometimes I had a lady just not long ago, the last couple of years. She was taking a medication that insurance companies did not like. It was a narcotic, and she got denied. And she realized that was the only thing keeping her from getting a supplemental plan. She stopped taking the med. 2 years later, we got her a plan. All right? Yep. So medications can keep you from getting plans, and health conditions.
Gloria says, will ALS prevent my husband from going from an Advantage to a supplement?
Absolutely, Gloria, and I'm sorry for that. Yeah, Lou Gehrig's disease, definitely declinable. Now, if you live in New York, Connecticut, Vermont, Maine, Massachusetts, no, you could still get a supplemental plan there. But anywhere else, yeah, you will not be approved. And I'm sorry about that.
Okay, are there indemnity plans that can help pay for short-term hospital stay if on an MA plan?
Mm-hmm. Yeah, there are. Yeah, they're called Indemnity Critical Illness, copay protection plans. And so we recommend them, and especially if someone really has a tight budget, and if they did get ill on their Advantage plan and they had a max out of pocket of $5,000 or $8,000, and they don't have that money, then they most certainly ought to get an indemnity plan to cover those expenses, hospital copays, and then they'll do a lump sum for critical illnesses.
Yeah, and indemnity is like a big jargony word. Mm-hmm. So basically the way how it works is if you go into the hospital, you can buy a separate little insurance plan. Mm-hmm. For $35-40 a month, so that it will reimburse you for the copay that you would be responsible for under your Advantage plan. So let's say you get an Advantage plan that has a $300 a day copay for 5 days. So that's $1,500. So that little indemnity plan that you would buy on the side would just reimburse you for the cost of that. It could also reimburse you for if you had some sort of a surgery, or maybe if you had cancer, it would give you a $5,000 or $10,000 payout. So indemnity just basically means reimbursement.
That's right.
And it sits alongside your Advantage plan. And we recommend those all the time.
Yeah, and I'm going to add this, Josh. Everything you said is 100% correct. With indemnity, look at it this way as well. Indemnity pays you. Health insurance pays the provider directly. The indemnity plan will give you that $300 a day for being in the hospital. So they'll write you a check.
Okay, this is an interesting question. I have Medicare Plan G and Social Security age 68. I am still working W-2 with Medicare Social Security deductions. Will I get future compensation for these deductions? Anticipate working for another 2 to 3 years. Like, is there going to be some sort of credit since she's still paying in the Social Security system?
Oh, okay. Okay, and you're age 68. Well, yeah. What happens if you were younger, then they would recalculate your Social Security benefits at your full retirement age, but you're already beyond that, so no, you're not. Yeah, I've never heard of a recalculation of Social Security benefits after full retirement age. So
Jay Patel says, since I am in good health, can I apply for a supplement plan at a later stage in the future? I'm signing up soon for A and B.
yeah, as long as you remain in good health, because you said you're going to sign up for A and B, so your 6-month window of no underwriting will start on your B date. And so if you kind of roll the dice, Jay, and get nothing, and a year, 2 years down the road, something happens to you, you may have a health condition that would not be acceptable by the insurance company, so it could hurt you. But as long as you stay healthy, it may be fine. I don't like that option, Jay, A and B by itself. I wouldn't do that. If you say I'm not going to do a supplemental plan, then at least reduce your risk by enrolling into an Advantage plan, because at least Medicare Advantage plans have a max out of pocket. With A and B alone, you have no max out of pocket. It just keeps going and going and going, meaning it's unlimited financial liability for you on A and B. And let me tell you this, Jay. There's $220 billion of debt in America right now, medical debt, unpaid. Hospital bills, doctor bills, $220 billion. And the second largest age group holder of that debt are those that are Medicare eligible, 65 to 74. The second largest holder of that debt. Who is that? That's people who have A and B only, or have an Advantage plan and they couldn't afford the max out of pocket. So I wouldn't do it, Jay. I would not.
Kind of like waiting to get car insurance, so like sliding into the car in front of you.
Yeah,
like,
or your house is burning down and you want to call and get insurance, right? It's too late. Too late. So I just wouldn't take the risk, Jay.
Okay, this is a good question. On a supplemental plan, do premiums go up as you get older?
Okay. Well, it is possible for them to go up as you get older. That is called an attained age pricing method. Attained age. Many states use that. The two that don't go up as you get older would be, now by the way, you're going to get older regardless, okay? But the other two rating systems are called community and issue age. Community and issue age. And so those premiums do go up, but those plans only take group increases. So they all go up, but community and issue age are group increases. Attained age takes an annual increase because of age, and then they also can have potentially group increases. I still like attained age, and I'm going to tell you why. Because attained age starts much lower. Now, let me just give you a quick example. Let's say that I'm turning 65. I'm a lady. I'm a female. I may have let's say a G plan that would be attained age at $125 a month. Issue age is probably going to be about $150 or $160 a month. Community is going to be about $200 a month. So attained age starts lower. Yes, it'll go up a little bit every year, but as they allow the insurance company to go up a little bit every year, those increases offset or at least minimize group increases. So we find that attained age policies oftentimes can perform better. And I'm not saying one's better than another, but only one can go up because of age, and that is attained age.
And you can call in, and we can help you.
Yeah,
know
exactly.
What state and all that, all those specifics.
That was a great question, but it is pretty weedy. Sorry about that. Go
Okay,
ahead.
Megan Salderman says, do you foresee MA carriers reducing bells and whistles to reduce costs?
Yeah, I think we're going to see that. We don't know for sure. We do know that Advantage companies did not get the amount of money from the government they wanted. They're still getting plenty of money, but we think because there's less of that, we think there's going to be some adjustments. And I'll tell you another reason too, because we're seeing a lot more higher use on the plans, and also because the government's starting to crack down on them and all these denials and delays, and so they're going to have to start, saying yes to more services. That's all there is to it. So I think we'll see some. How drastic? We'll find out here in a couple months.
Okay, D. Sylvester said, I just joined the Medicare School family. It could not have gone any more smoothly. Caitlin took excellent care of us, and her info was spot on. Happy customer here. Thank you.
Good.
We're happy to hear that.
Yeah, and Caitlin is a sweetie. She is a sweetie. Hard worker, cares about people. Wonderful.
Peter Ehrlich said, can I find a copy of this after it's finished? Yes, it will be on YouTube. We'll probably slightly edit it, get rid of some of the fluff and the audio issues, but it will be on YouTube. DG said, I'm a client. Joanna Torres says, yes, I'm your client. Yves Lamore said, I'm a client and glad to be with you. Seek to find client. Connie Awad. Hello, I'm a client with Howard S. Wonderful.
All right, Howard Siegel. Wonderful.
Teo, I'm a client. Good. Love that you guys are on. Kat, I'm a client with Evan Cruz. Also arranged for my husband to work with Evan for his Medicare Supplement plan enrollments.
Good.
I signed up with Steven Swanson. Okay. I work
All
with
right.
Karen Miller. Okay, next question. If I go with an in plan, what percentage of doctors charge the 15% extra, and is it geographic or not?
I can't say it's geographic. I would say it's more health condition. But again, less than 5%. So it doesn't happen often. Number one, there's 8 states where it's not even permissible. 42 it is. I can't say it's geographic that I'm aware of. I would say we're gonna see it more in kind of cancer care, specialty type of situations where there's more technology involved. There's more specialists involved, and they just say, hey, we can't make it with the rates that Medicare is going to pay. We're going to add 15%. So that's what I'd say. I know when you're on a Advantage plan, of course there can't be any excess charges, but the problem is you have those network issues. In fact, there's a very interesting stat out just recently that the majority of high quality cancer facilities, Advantage plans, are not in their network. Very limited. I mean that. Yeah. Just came out. I read that about a month or so ago.
Okay, Nolan Carl says, I was just laid off. I have Medicare Part A because my employer was a qualified healthcare group. Now I'm going to add B. What are the dates or the process to first get Medicare B, a supplement or Advantage? Well, First off, we can answer the question, but you ought to call us, get an appointment set up. This is exactly what our team does every single day. Take people who are just laid off or getting ready to retire or turning 65 and just walk them through the process. You need to send this paperwork here. You need to get this signed by HR. You need to do this, this, and this.
Yeah, and this can all be set up, Nolan. You can start 8/1.
Yeah.
Okay, and we'll tell you what paperwork's necessary. Walk you through it. Tell you exactly what to do. And you need to start 8/1 because if you've lost the group plan, your property coverage through the end of this month, and the only option after that is COBRA. And if you stay on COBRA, keep COBRA. COBRA only pays second, so you have to enroll into Medicare. Really 8/1 sounds like in your scenario. Otherwise, you're the first payer.
Yeah, and
so
we've
don't
seen that
delay.
be really expensive for people.
Don't delay this. Don't panic. Just get moving. Call us. We'll help you.
Yeah, you're going to fill out, you're going to get 2 forms filled out. One's called the CMS L564. One is called the CMS 40B. Those are your 2 forms that are going to allow you to get Medicare Part B without any gaps or without any penalties. The CMS 40B you fill out. The CMS L564, your employer, somebody in your HR department is going to fill out. Both of those go into the Social Security office, and then you're able to get enrolled in Part B. And then add the SUP and all that other stuff.
That's right. And all the forms that you're responsible to fill out, we will actually do your part for you. Again, Josh is right. It has to go to HR, but there's Section A that we actually fill out for you, and then you'll get it to them.
Cheryl Mickelraff said, Zeb Pearson was great at getting me set up with A and B, UHC supplement, and a well-care drug plan. Michael Webb said, I signed up for everything today with your agent, Dylan Blank. He was very helpful.
Good.
Joe, I signed up with Brian. Wonderful. Guys, thank you. This really means a lot to us to be able to see all these. All right. Okay, let me see. I'm trying to get through all the people saying they're a client. Okay, what's my maximum out of pocket for a specialty drug that's not covered by Part D?
Okay, well, if it's not covered by Part D, then there is no issue. I mean, you're 100%. You're gonna have to pay for it. Yeah. What I would do if I'm in your situation is I would ask for a formulary exception. So whatever plan you're on, ask them if they will add that medication to your formulary. Okay, and if they rate it as a specialty drug, as long as they cover it, this year the most you would spend all year long is $3,350 out of your pocket. Next year it's going to $2,000. But again, if it's not covered by the D plan or you don't get a formulary exception, then you're responsible for full price. In that regard, I'd probably call the manufacturer and see if they have any kind of programs where you can get those at a reduced cost.
Okay, Jeannie says on Medicare now, but going back to a government job with FEHB benefits, can we husband and wife drop Medicare, go back on later without late penalty?
Yes, yeah, you sure can. And what I would do, Gene, keep A. There's no cost for A, so drop your Medicare Part B. And then the way you do that is there's a form, and each of you would need to do your own form. It's called 1763. It's very simple. It's the form used to disenroll from B, from immunosuppressive drug plans, premium A, all that. But it's the form, 1763. And you'll put your name in there, your Medicare number, and then they're going to ask you when you want to drop your coverage. And so on that form, Part B is called medical. A is inpatient, B is outpatient, A is called hospital, B is called medical. So you'll put in there you want to drop it, whatever date, 7/31 or 8/31 effective date, and then they're going to ask you for the reason. And go ahead and put in there that I'm returning back to work and I don't need my Medicare B any longer. And you'll mail the form in or fax it in or drop it off at a local Social Security office. By the way, if you fax it, I would also mail a hard copy. If you drop it off, you can drop it off at the Social Security office and they will process that and they will drop your Part B off and they'll mail you back a new card that'll say Medicare Part A only. And the key is when you want to come back in a later date, Gene, just be sure that from the date that they drop you, you stay on some type of an active employer-provided plan, such as the government. And then we'll verify that to bring you back into Medicare B at a later date. That's called the special enrollment period.
Okay, what are options for dental and vision? Does Advantage or N or G cover these?
Yeah, Advantage, yes, will give you some type of a dental allowance and vision allowance. N or G will not. If someone has a supplemental plan, you actually have to buy a separate dental plan. I do not call Advantage plans that have dental really a dental plan. It's a dental allowance. They'll cover up to maybe $1,000 or $1,500 a year, but you usually have to use one of their dentists. A true dental plan would be a PPO. You can probably go anywhere you want to go, and they'll cover about $3,000 to $5,000 a year. So that's a true dental plan. And by the way, if you're on an Advantage plan, you can buy a dental plan as well. Those are separate plans.
Okay, so Advantage would not pay for cataract surgery?
Yeah, Advantage plan for sure will pay for cataract surgery. What you would have, it would be, you look in your summary of benefits, and it's going to list outpatient surgery. So whatever your copay is in the schedule of services, at probably $250 or $350, something like that, and that would be per eye. So if you're having both eyes operated on, they absolutely will pay. Advantage plans will pay. You just pay a very reasonable copay for that. Okay, yeah. And if you're having lens replacement, they pay for the basic lens.
Pat England says, I qualify for extra help for Part B with Medicare. Would that be extended to also help a supplemental plan?
No, it would not. Yeah, your extra help is going to cover Part D plans, copays for medications, that type of thing. And then the Medicare extra help plan, that pays for Part B premiums if you qualify for that, but not for supplemental plans at all.
Okay. Does Medicare cover air ambulance services if medically necessary? If I live in a remote area, should I buy a separate insurance plan for air ambulance?
Yeah, well, Medicare will cover that. I know there's some certain kind of stipulations for it. Honestly, I've never had a client that had to use air ambulance. I've had some air evacuations around the world, from clients. But yeah, but they do. And I know there's some rules, but I'm sure if it's medically necessary, it would definitely be covered. And that would be at an 80-20 because that would be on the B side of Medicare. So your supplemental plan would have to follow if Medicare did pay. So I'm saying yes to that. Okay, and hey, and by the way, if you have a remote area and they've got a separate plan, it's reasonable. I'd probably have that as well, just in case. Yeah.
Let's see. My husband just retired. We are now on original Medicare and a supplemental plan. He has a scheduled MRI prior to retirement. Would we have to pay for it if he requested it from his doctor?
You understand the question?
He has a scheduled prior to retirement.
Okay.
Oh.
Just retired.
So it's like it was scheduled probably under employer insurance. Now they have Medicare and a supplement.
Oh yeah.
Medicare pay
Okay,
for
now I
it.
understand. Yes,
Yeah.
they will. That's it's all based upon the date of service. And so if he is now on Medicare, even though the point was set up prior, it won't matter at all. Date of service. Now, when you go to get that MRI, you're going to give them updated insurance information, but it's no problem. Yeah, you're fine. Date of service matters. So if I'm going on Medicare August 1, if I was, and I had a test today, not covered. If I have a test August 1 or August 2nd, covered by Medicare.
Robert Scott
problem.
says, can you be insured by more than one dental plan?
Absolutely. Yep, we have several people that will have a couple dental plans. You can. They're all standalones. They'll coordinate the benefits together, and not a bad idea if you have some teeth issues for sure.
Okay, let's see. We've already answered most of these questions, so go back. And if we're skipping over these, probably because we've already answered it. I want to try to get some different things. Okay, I'm a veteran currently working with TRICARE, turning 65. Would there be an advantage to going on an MA plan? How would it affect my TRICARE?
Okay, a lot of retired military people are doing that, and I think it really is a fine option. And so what that would mean is that of course, you're enrolled in A and B, and then TRICARE will coordinate benefits either with A and B, or they'll coordinate benefits with that Medicare Advantage plan. If you do this, MA plan does not include drug coverage, so you're going to continue to use TRICARE for your prescriptions, and it's not going to affect them in any way. The reason that some veterans, some retirees from military do this is because most of your MA-only plans are going to give you some kind of a Part B reduction. Sometimes they're $120, $150 a month. And so a lot of people like that. So because you enrolled in a plan where the Medicare Advantage doesn't have to cover your medications, you get those through TRICARE, they're willing to give some of that money back to you in the way of a Part B reduction. And you get some of the perks on the Advantage plan that TRICARE did not offer. But here's the best thing. If you decide you do not like that system, 2 different times of a year, you can disenroll from your Advantage plan and go back just to original Medicare A and B with your TRICARE alone. Okay? So I like that. You're not permanently bound to that at all. You'll never lose your TRICARE.
Okay, Marie says, I live in Washington State and I have Plan N. If I wish to switch to G, am I right in saying that I will be denied through underwriting due to a recent skin cancer treatment of one of your clients?
Okay, well, first off, you can, at any time of the year, they have open enrollment for switching plans in the state of Washington, so you don't have to go through underwriting. Now, you have N and you want to switch to a G, you would have to go through underwriting. But if you want to move from an N to an N, you would not have to. So let's say you do want to move into a G. Then now, if it's just basal cell, not a big issue. Melanoma would be an issue. Sometimes the other one, I forgot what it's called, but most of the insurance applications, they're concerned more about melanoma. And so with the right carrier and you have no other health issues going on, you should be able to get through underwriting to move from N to G. And if you can't do that, then once you've been cancer-free, treatment-free for 2 years, you usually can anyways. So you have a couple options here. Call us and you're one of our clients. We'll help you through that process.
Do you sell policies for Physicians Mutual? And the answer is that in like a week we will be able to. So
right now we don't, but
yep.
Good. Yeah.
Okay, I have Plan G, deductible of $240, so I need surgery. I paid. Well, I don't know where the rest of this question went. Okay,
And that's true. You pay your $240 once a year and you're done. 100% coverage after that. Yeah.
Okay, I was automatically enrolled and received my Medicare card because I received Social Security survivors benefits. I will turn 65 in August. I'll be relocating soon from my current state. I spoke with one of your guides yesterday, so I've begun the process of deciding which way to go. My question is, if I move now and choose a plan, but in a year I need to relocate again, it's complicated. How difficult is this to transfer plans, and what all is entailed in this transition?
Yeah, quite frankly, it's very simple. If you go with the supplemental plan, it's just going to follow you. When you relocate, what happens? You do a change of address. The Postal Service will notify Medicare that you've moved, which then notifies your Medicare Supplemental plan. And then what they may do is re-rate you. They have the right to do that. Now, some places rates are about the same, but some places you move and they may raise your supplemental plan a little bit, or they may lower it a little bit. So it's really not complicated at all. The only thing that you'll have to do is, as you move around, you would have to switch your Part D plan. But again, we have a process, a system we use, so it's a little extra work for you. But the SUP is very easy to move. It sticks with you. The only thing they can change is the rate, up or down.
Okay, Ed said, if Medicare School is not the agent of record for the supplemental plan, will that prevent Medicare School from selling the Medicare D drug plan? And generally the answer to that is yes. Drug plans are the most complicated, and also they don't really pay much of anything. So we love to help people, but generally we if we help you with the supplement plan, we'll also help you with the drug plan. We don't really work with drug plan only customers.
But you can go to our site and he could,
You can call in and we can send you directly to our site with a bunch of training. You can actually compare all the drug plans and enroll. It takes about 10 minutes. We have really good education on how to enroll in drug plans yourself.
Yeah. Happy
and
to do that.
Doing that, you'll be fine. Okay, can I switch to you if I signed up for my supplement with a local agent?
Well, it just depends on the carrier that you have. Some carriers, it's pretty easy to do that. Hey, call in and we'll find out who you're with, and then we can let you know that. We'd be delighted to serve you. Each carrier has its own rules for changing agent of record. That's all.
Okay, this is an interesting question. I can see you're
okay. I got
confused.
it.
Yeah,
I understand.
Saying 6 months
okay, very
before.
good. Here's why.
Well, let me ask the question. So you were saying 6 months before and 6 months after. I thought it was 3 months before and 3 months after turning 65. What am I getting confused?
Okay, very good. Well, both are true. Okay, but let's talk about the 3 months before and 3 months after. That has to do with coming into Medicare for the very first time and setting up your Medicare account, your A and B account. When you start at 65, that is a 7-month window. 3 months before you turn 65, the month you turn 65, 3 months after. So that is 3 months before, 3 months after of 65, getting you into Medicare A and B. But now once we have Medicare B, now what happens, we can get a supplemental plan. We can apply for that plan 6 months in advance. Now, it's not going to start 6 months in advance. It's going to start on my B date. But I also have then an additional 6 months after that where I still am in that period where I can get a supplemental plan. No underwriting, no health questions, no meds, get whatever you want. Hopefully that clarifies. So those are two different topics.
Lloyd Kinney says, my husband Bill is a client of yours and I'm a future client. Bill worked with Josiah and I thought he was great.
Oh, that's great. Thanks for the encouragement. Hey, I have 7 children, 5 biological children. This is my firstborn son and 2 adopted children. And Josiah is our 5th biological child. And he works for us, works hard. We also have a son-in-law, Josh Roof, who works for our company. So, yeah.
Okay, on Social Security disability at 60 last year and took MA plan because of the cost for a supplement plan. When I turn 65 and select a sup plan, will I have to medically qualify?
No, you won't. No, you won't. You got your plan at 60, and you're right. Some states allow the carriers to charge more, which is a shame. But when you turn 65, you're entering into a period that we call your IEP2. So you're going to have a second eligibility at 65, 3 months before you turn 65, month up, 3 months after, and you can get another supplemental plan, any carrier you want, and it's just like you get to reset the clock. No medical qualifications as long as you do that no later than that 6 months of your 65th birth month.
Is it a problem to switch from a Medigap plan, like a supplement plan G, to an Advantage plan if I change my mind?
Not at all. The only thing you have to do, though, you got to keep in mind, you just can't do it any time. You have one time a year that you can make that particular switch, and that is October 15th through December 7th. So your Medigap plan would cover you through December 31, and then the Advantage plan that you selected during that time would go into effect January 1. Okay, once a year that can be done.
Not a question, but a thank you. I've called and talked to your staff twice in the past month, and they were wonderful in their assistance. Amazing. Let's see. Turn 65 next month, still working and have insurance through the school district. When I quit work, will I be required to take blood tests when I start supplement insurance?
Not at all. Not at all. So just, if you do anything, Lori, right now, just enroll into Medicare A only. Don't take B, just A only. Now, if you have an HSA, a health savings account, don't take A either. If you do, you can't contribute to your HSA. So if you don't have an HSA, enroll into A only, and then when you get ready to retire down the road, you'll start your B, and then you'll enter into that time where you can get a supplemental plan with no underwriting at all. No blood test, nothing.
Scott Boehner says, what's the typical price of a drug plan, a good one?
I'd say right now, probably average good drug plan is going to be about $30 a month.
Yeah, there's some decent ones that are like 50 cents.
Oh, yeah.
We are expecting that price to go up quite a bit for 2025 because of the $2,000 cap. So that $30 may go up to like $50 being
right,
the average.
Yeah. And Josh is right. There are some low-cost plans. But you say a good one, what I see, that's kind of a medium-range price, $25, $30.
Okay, my plan G is significantly more than what I was told when I signed up with you. If I'm still in my IEP, can I switch to plan N, Or could I switch down to end during OEP? I mean, okay, there's a lot of confusion.
Yeah,
there.
hey Pam, definitely you want to do it ASAP then. I'm not sure what happened there, and I'm really sorry for that. And so I wouldn't wait to OEP. I mean, I would do that now, especially if we're still within 6 months of your B date. It's a very simple transition.
IEP and OEP really don't have anything to do with this question at all. If you're
right.
within 6 months of when your Medicare Part B effective date is, you could switch supplement plans every month 6 times.
Yeah, and
without
you
any
can do it
medical
anytime
underwriting.
with that underwriting.
Yeah.
I mean, with underwriting. Sorry.
Jay Rose says, can you serve people in any state?
Yes, all 50.
All
NDC.
50 states. NDC. Okay. AS, you said, I'm on YouTube and it seems my questions are missed. Maybe try typing it in. Trying to see if we missed anything in here. I think we're good, Dad. I think that's all of them. Okay. Guys, thank you so much.
2 weeks we do it. Okay.
2 weeks.
Yeah, we do
every
these every 2 weeks.
Okay.
Exactly.
So we will be back whenever that is, 2 weeks from now. And we look forward to helping you in the meantime if we can. The phone number is scrolling there along the bottom of the screen, 833-833-3661. And we would be honored to assist you guys. Thanks. Have a good
Thanks
night.
very much. See ya.